School curriculum is often a highly contested space, which can make it difficult to introduce a new subject, such as comprehensive sexuality education. In the Eastern and Southern Africa and West and Central Africa regions, there are various modalities or ways that comprehensive sexuality education is delivered. Often these modalities differ by country, but sometimes also within a country by levels, geography, or types of schools. The most common modalities include standalone, integrated into a few subjects, integrated into one broader subject, or even infused throughout the curriculum. These modalities, we start with standalone. In this case, comprehensive sexuality education is introduced as a separate subject, and in most cases is delivered by a specially trained teacher, as it is a case in Namibia. Only a third of countries implement comprehensive sexuality education as a standalone subject, and when it is integrated into one subject, sometimes it is taught in a subject called life skills education, health education, guidance and counseling, life orientation, and it is large enough to accommodate comprehensive sexuality education in these subjects. So some countries which have followed this approach are like Botswana, South Africa, and Zimbabwe. Sometimes, or in other cases, it is integrated into more than one existing subject. In this case, it happens also in Botswana, Democratic Republic of Congo, Ethiopia, Madagascar, Malawi, Mozambique, Rwanda, South Sudan, Tanzania, and Zambia. Whereas in other countries, it is integrated or infused throughout the curriculum. Comprehensive sexuality education is integrated in most or all subjects included in the curriculum, with or without any specific mention of HIV and AIDS in subject areas, as it is in Mauritius. And teachers also include comprehensive sexuality education issues in their lesson plans and in the delivery, regardless of the subject they are teaching. Remember that comprehensive sexuality education delivery modalities differ by country, but sometimes also within a country by levels, geography, and types of school. Understanding the modality for the delivery of comprehensive sexuality education will inform how you either leverage the benefits or address the challenges that are faced or that you face with delivery in your school setting. To better understand these modalities, you need to review the pros and cons of different modalities, as I have mentioned them above. And you have to remember that the best modality can depend on the context in order to leverage what works best in any given setting. Standalone modality has some pros and, of course, cons. Firstly, it gives an opportunity to cover, like, in details, specific topics, and teacher training is focused on specialized teachers who may choose to develop a career path in the same area, and enough time is allocated to the content, and it is easier to monitor and evaluate, and the designated teacher is accountable for the curriculum. Assuming it is institutionalized, it is easy to make it compulsory, it is easy to develop and update the materials, and potentially the most cost-effective option in terms of numbers of teachers trained and dedicated teaching and learning materials. However, some cons include It's hard to compensate for missed content, and not many tutors are specialized in this field of study. And this may also increase the workload on the teacher. Another one is that easily, sometimes if it is not examinable, it is easily sacrificed. Indeed, it may require some extra budget implications for the ministry or the school to make that subject effective. When it is integrated into a subject, it has some plus whereby learners will learn aspects of comprehensive sexuality education even if it's not compulsory. All levels benefit from topics of comprehensive sexuality education even though they are integrated. It creates opportunities for learning across the curriculum. It allows for the use of existing assessment modalities, and it reduces pressure to create space in the timetable for new subjects supported by dedicated staff and the new training needs. However, on the con side, methodologies are used. It leaves the scope and depth of curriculum at the discretion of the teacher. Selective teaching is prevalent, which focuses on content that is less embarrassing to talk about in class. It may be difficult to monitor at the level of learner, as potentially more difficult to assess and examine because of the multiple career subjects. It may limit accountability and ownership in the curriculum, and potentially less cost-effective as there is a need to train and monitor a large number of teachers and produce more teaching and learning materials. When it is infused in the curriculum, then there is a great opportunity for coverage of comprehensive sexuality education, and it is very easy to institutionalize it. However, there is a risk of content getting diluted. Maybe it might also be difficult to apply certain methodologies like participatory, given the need to monitor large numbers of teachers and produce more teaching and learning materials. Thank you for listening. Until we meet again, bye-bye. But there is a room for asking questions. In case you have a question, you can drop it in the comment section, and we might talk about it in the upcoming video. Thank you.